going to be a hot one for several days. Thank you, Bruce. It is time now for medical rounds. We are seeing the number of COVID cases skyrocket in other states. So what's been critical in containing our numbers here in Connecticut? Earlier today, I spoke with Flaks. He is the president and CEO of Hartford HealthCare about that. Why are we doing so much better?
Look, I think this is really great evidence of the commitment of all of our communities, all of our citizens in Connecticut, and the culture, the alignment of the measures we've put in place. I mean, Kara, it's absolutely critical for people to wear a mask, socially distance. We need to practice our hand hygiene throughout this process, and we need to remain really committed around the travel guidelines that have been put in place. So, to me, it's vigilance. And it's really a reflection of the measures we've taken since the very earliest stages of this pandemic.
And numbers, of course, can change rapidly. We've seen that. Do you expect a surge here? And how should we be preparing for back to school and flu season?
Sure. Well, look, from a health system perspective, we absolutely need to be prepared for a surge. We need to prepare for the worst. We have to hope for the best. So we are putting measures in place and have been putting measures in place around building our stockpiles of personal protective equipment, perfecting all of our practices we've put in place, doing everything we can around the coordination of all of our resources, that if and when there is a surge or a spike, that we're well prepared. But that being said, at the same time, we have 18 patients today across Hartford HealthCare, so it's dramatically been reduced. From a testing perspective, we're doing 1,800 tests a day.
Wow.
And when we look back over the last 11,000 tests, we've had a 0.6 positivity rate.
Given where everything is right now, fingers crossed, if it stays the way it is it safe to send kids back to school in the fall here?
Yeah, I do believe ultimately that it will be safe to send kids back to school with the provisions that all the safety procedures, all the measures that are being taken around the physical facilities, around the use of testing, the screening around different symptoms and so forth. So there's many measures that need to be put in place, really no different than what we're doing in healthcare and have been doing, that allow us to manage and monitor this very closely. So I think we have to continue to support the measures, be very attentive to them, and then recognize that we also have to tolerate an element of ambiguity. And based on the data, what it tells us, we have to have contingency plans in place,
right,
if necessary, if we feel safety could be compromised.
Flaks, always good to talk to you. Nice to have a good report card for Connecticut right now. Thank you.
Thank you.